From the News Channel 5 Network, this is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on MorningLine. I'm Nick Barris. It is Thursday, and I'm glad you're here. I'm glad you're just turning on the TV and joining us on this program this morning. We're going to be talking today with two guests with Mental Health America of Mid-South. I'm going to introduce them in just a moment. And about a topic I think is important and something that I think we can always think about. And I try to think back to when I was a child, and back then, folks didn't talk about it all that much, but the whole idea of mental health issues, treatment, and the stigma that can sometimes be associated with it, especially with regard to youngsters. And let's face it, in this day and age, especially with what we're in right now during this pandemic and everything else, people are dealing with mental issues, depression, anxiety, and the like, young people as well, and how there is help out there available, and also how if you're talking about it and people learn about it, that you don't get stigmatized for it, okay? It's not a negative thing to seek help, certainly, and mental health treatment, in my opinion, is every bit as real and as important as any treatment you get for a physical ailment, all right? And so we're going to get into that this morning with two guests who are terrific with this great organization. Let's introduce them to you now. And by the way, as always, we'll take phone calls if you'd like. We've got the phone lines open. We're also streaming live on Facebook right now at newschannel5.com. Dr. Desiree Kelly's with us this morning, and Heather Smith. Can you both hear us?
Yes.
Good, loud and clear. Well, thank you both for coming on. Good morning to you both. And listen, Mental Health America of the Mid-South, and really what we want to talk about today, and you do so much, is Erasing the Stigma Youth Program. And let's just first talk about stigma as it relates to youngsters and how it might manifest itself. Well, when you talk about stigma, what do you mean by that? And what I mean is not just, don't give me a clinical example, give me a real life example of how it might affect a child.
So stigma in itself is a bias, a discrimination, a stereotype, a mark of disgrace that somebody usually puts on somebody in the mental health community, somebody who might be living with a mental health illness. Some examples that we use daily, and we use because maybe it's part of the new slang or different cultures, but they are stigmatizing to the community. Some of those terms are cray-cray, psycho, crazy, nuts, bananas. Those are terms that we want to remove from our vocabulary because it is hurtful to people who are living with a mental illness.
Absolutely. And I'm wondering, Heather, with what she just said, when a child is dealing with a mental illness, and the names that she said can come up just, whenever in a school setting, I suppose, but do classmates sometimes become aware of another classmate who is dealing with some of these issues, and how do they learn about that? I mean, do they observe it? Do they see behaviors and it tips them off? I mean, it's not like they go around advertising that they're dealing with depression, right?
Sure. So there can always be different signs and symptoms that might demonstrate to peers or even to yourself that you might be dealing with something that indicates a mental health challenge or a mental health disorder. And so part of what we do with our program is educate young people about what those signs and symptoms are. And it really does encourage them to speak up and ask for help. Because if we don't talk about it, we don't have that conversation, then they might just only hear those stigmatizing words, that stigmatizing language, and it can become such a barrier where young people don't feel confident to say that they're struggling and get the help that they need. So that's part of the goal of our program as well.
And I'm wondering if you both feel, and maybe it's different from adults to children, but is there still a perception in society today that if a child walks in with a broken leg and a cast, and people see it and they acknowledge, all right, broken leg, cast, and they just go on. But if a child somehow exhibits the symptoms, say, of bipolar or anxiety, and it manifests itself, they're not quite as understanding of that as they would, say, a physical ailment like a fractured leg?
Oh, absolutely. And definitely, let's add more. Depression, PTSD, particularly with what's going on in the world with the pandemic and other different things that are hitting the general public, but you don't know. That's why you have to ask the questions. That's why we introduce trusted adults into our Erasing the Stigma Youth Program, which many people know as I See Hope. But children, youth, young adults, even adults. When we struggle, it's easier for us to say, you know what, I'm not feeling well. Maybe I have a headache. Maybe I have a migraine. But many of them don't come up and say, you know what, I've been diagnosed with depression and I'm having a depression bout, or I'm having extreme excessive sadness and I need to take care of that. And that's what we want to educate our youth about, because at the end of the day, if you don't tell anybody, then we can't come in and help and provide support and referrals to therapists. So that's what we want to do. That's our goal, is to educate. Does that make sense, Nick?
Oh, absolutely. I see that. And I guess maybe you can give me a sense, Doctor, too, of how you know when you're at that point. And maybe young children just know how they feel. Adults maybe, can better tap into what their emotions are and whether or not it's an issue. We all feel anxiety at times, and that's going to be normal. And, that just is going to happen. How do you know if you're dealing with something that is just typical anxiety that any healthy human being is going to maybe deal with on a day-to-day basis, especially during this pandemic, or if you have a real true issue that maybe needs to be addressed? What's the difference? Where's the line?
So let me first say, I'm not a clinician. I have my doctorate in public health. And so we work very well with social workers, because what we do is educate. And then the social workers, the therapists, the licensed clinicians come in and treat, right? So with what I and the Erasing Stigma Program employees do, which Heather is from Middle Tennessee, and then we have another one in West Memphis. West Tennessee, I didn't mean to say Memphis, but her name is Patrice Buckley. But what we do is we observe, we notice. These are things that we can do. We can talk to the counselors, because we're bright and shiny. When we come to the schools and we talk about the different topics, many people will say, oh my gosh, this is what I'm suffering with. This is what I'm dealing with. This is what I'm living with. I've been bullied. I want to take my life. These are things that we hear. And so when we hear it, the first thing we do is follow protocol. We pull the counselor in, and then the counselor takes it from there. We provide the information and the resource and the education, and then we bring in the counselor to provide the treatment.
I've got you. And you did mention that, and Heather, maybe you've seen this in some of the instances here. The reason, among others, that's very important is, and she mentioned it, I mean, if the help doesn't come, and we know about teen suicide rates, and you mentioned bullying, which I don't know if bullying blurs into this as well. I think bullying can certainly be a source for anxiety and depression for a lot of these kids. If it's not addressed, I mean, is that something that, if it's not, can lead to, well, I guess we know suicide, which is why it's so important we deal with this.
Mm-hmm. Agreed. I want to interject for a second. Some of our top requested presentations from elementary school all the way to high school, our top 3 in elementary is bullying prevention, worry and anxiety, and anger management. But Nick, as we segue into middle school, our top 3 would be bullying prevention, speak out, our suicide curriculum, and mental health and stigmas, right? And you see a couple of them change, but it's still bullying. Bullying is still that major presentation that we get asked to present over and over again. And then when we go into high school, it's stress and depression, bullying, and then stigma and mental health. That's kind of major, because we see a shift, but we're actually seeing that in every grade level, bullying is there. Bullying, education, and strategies and coping skills need to be addressed. And so we do a pretty good job of that. I'm very proud of our work.
Absolutely, going in. And Heather, do you think kids are willing to talk about it if they're approached? Maybe if they're not the ones reaching out, and who would be the one to approach them in a school setting?
Yeah, sure. So I think, first of all, they probably already are talking about a lot of these things, or at least hearing about it. It's all over Instagram. It's all over a lot of these social media platforms that they're probably accessing. Talking about mental health is something that's becoming more and more trending, so to say. And so that's one of the reasons why we think it's so important to have this conversation at school, so that they're not just getting information from anywhere else, but they're also getting it from the specific adults in their life who can be their trusted grown-ups, right? So we do the prompting, and then the school teachers, counselors, prevention specialists are there following up. building those relationships with the kids and being able to connect them to further resources if they need it. As well as encouraging the kids to really identify who are those trusted adults in their lives. And it can be someone at school, like I said, the teachers and the counselors who do fantastic work to really support our kids in these kinds of needs. But also, like, who do they have at home? Is it their parent? Is it their grandparent? Who's the trusted grown-up that helps take care of them that they can go to and talk about these kinds of things?
Okay, well, that's great. And we're going to get more into some of the programs, and we have some phone calls for you as well. And I've got some questions. You talked about, what's on social media and the like. And that unto itself can be a tool for good, and it can also be a real pain and cause a lot of problems for kids, which is something I didn't have to deal with growing up. Gosh, I'm glad I didn't. Gosh, some of the stuff on social media is absolutely horrible. So we're going to take a break. We'll talk about that, maybe how you can manage that with your kids. Let's face it, everyone's on their phone and the computer. And we'll take your phone calls as we continue to talk Mental Health America of the Mid-South with our two fine guests. Back with more right after this.